My name is Carl Cirino, and I'm a shoulder, elbow, and sports medicine surgeon here at the Hospital for Special Surgery. As a shoulder and elbow surgeon, I treat the myriad of shoulder and elbow issues that patients may face. It starts with young athletes who may have a traumatic injury, either a shoulder dislocation or a fracture, all the way up through shoulder arthritis, rotator cuff tears, and fractures in older patients as well. So my goal as a physician is to get patients back to the level of activity and level of whatever it may be that they desire. So, some patients come in and they tell me that they have debilitating pain. They don't play pickleball, they're not worried about running marathons, they just want to get out of pain. And, we have a lot of great options to treat that. Some patients have a desire to get back to tennis at a high level and compete in their local championships and get medals and flags on the wall, and if that's their goal, then that's what I want to help them accomplish. So one of the advantages of focusing exclusively on the shoulder and elbow is that you really get to know the anatomy of the region. Human body is an amazing evolutionary marvel, and there's a lot of nuances to the anatomy that we have. So focusing on one part of the body enables me to really fully understand the functions of the shoulder and elbow, the anatomy, and the best way to treat any issues that arise with that part of the body. So as a Connecticut native, I couldn't be happier to get back to the Connecticut region to help take care of patients. Many that I grew up with, many that have moved to the area, but all have a sense of pride for the Connecticut region. HSS Connecticut has been a tremendously successful endeavor so far, and I'm incredibly honored to have joined it. And really just get an opportunity to treat the patients in the region that I grew up with and give back to the community that gave me so much as I was growing up. Seeing success in a patient is why I come to work every day, whether it's a high five, a hug, patients wanting to take pictures with me or their x-rays to show their friends. Really the word of mouth. So when a patient comes and says, oh, my friend Ann had a great outcome and referred you, that's really what helps me get up in the morning and makes it through their day, because they can be long days, they can be hard days, but there's nothing that makes my day better than a satisfied patient.